Hello, I am Dr. Rajpal Singh, one of the senior interventional cardiologists at Fortis Hospital's Bannerghatta Road. Today, I am going to talk to you about what really happens when you come in with a heart attack. What is a heart attack? A heart attack is something which is an acute emergency. There are not many more emergencies than this. This is a life-threatening condition and needs to be addressed as soon as possible. You might have heard from various sources, be it Google or reading newspapers, that we refer to something called a golden hour. This golden hour is the time that is most beneficial, during which time, if the blocked artery is opened, it causes significant benefit in terms of saving lives, in terms of reducing permanent damage, in terms of reducing any significant cardiac arrhythmias, that is abnormalities of the heart rhythm. So if one of your relatives come, people like me who are well experienced will treat you in Fortis Hospital, Bannerghatta Road. What exactly happens would be an ambulance would bring your relative in or yourself in with ongoing chest pain. Immediately an ECG will be done, and when an ECG is done, you will see what is seen here, what we call as ST elevation myocardial infarction. So this is, as I said, a very important and a very crucial time for you, and you may not have the time to understand various terminologies that are used at that point. So I'll put it right for you by making it very simple. What exactly happens when you have a heart attack? One of the main arteries, there are three main arteries supplying the heart. One of the main arteries or one of their important branches gets blocked. And when it gets blocked, the blood supply to that part of the heart muscle is stopped, as a result of which you can have significant or irreparable damage to the heart muscle unless this is treated. Now, there are two ways of dealing with this. One way is, if you come within the golden hour, which seldom happens, is to give you a clot busting medication called thrombolysis. This can be done if you reach within the first 60 minutes of onset of pain. Beyond that, the benefit of this kind of therapy decreases. Whereas the other form of therapy, which is internationally accepted as the gold standard for treatment of heart attack, is primary angioplasty or emergency angioplasty. In these circumstances, what we do is we give you some blood thinners to start with. You are asked to sign a consent form wherein the risks and benefits of the procedure are explained to you, either by someone as senior as myself or one of our team members who are knowledgeable to tell you about what exactly happens and what doesn't happen. Here, once we have got your consent, we then wheel you into the cath lab, which is a very secure area, which is a very sterile area, wherein we are all draped in very clean, sterile gowns, and different parts of your body are painted and cleaned, be it the hand or the groin. In a vast majority of cases, we do more than about 95% of the cases that I do, we are done through the wrist. This is relatively painless and it's got a lower incidence of complications. However, if you are very sick or if there is problems with the getting access to the artery in the wrist, we go to the artery in the groin, which is not an uncommon procedure either. Once we have got the tubes, we then do what is known as an angiogram. An angiogram is a test which is done to look at the blockages, if there are any, where the blockages are, and it helps us to plan what further treatment needs to be given. This is what is done. Now you can see on your screen here, this is a coronary angiogram of a patient who has had or is having a heart attack. You can see that one of the main arteries on the right is completely blocked. And we, at this stage, we stop, we get you or your family members to come and have a look at the angiogram, and we tell them what is the next procedure. The next procedure is the treatment, which is known as coronary angioplasty or primary coronary angioplasty. If the artery is not reopened as soon as possible, you stand about 10 to 15% risk to life with an extensive heart attack. By opening this artery up, either by a drug or by the more advanced and more scientific way of dealing with this, which is primary angioplasty, we are reducing that risk from about 10 to 15% to about 3 to 4%. You might want to know what are the risks. The risk is risk to life, risk of a further heart attack, risk of a stroke, risk of bleeding complications, risk of developing kidney problems, or a composite of all of these. If this is done appropriately with experienced people, with a well-trained team, the risks are relatively lower than what we actually quote. But for practical reasons, we tell you what is the published data. Once your family or yourself agree for the procedure, what we do is known as the angioplasty, which is what you will see out here. We use a slightly bigger tube and we pass a very fine wire, as you can see the wire going down the blocked artery. Once we get the wire into the blocked artery, we then either use a balloon to open up the artery, or we use a tube known as an aspiration catheter to suck the clot out. And here you can see that we are using a combination of both. Sometimes if the clot is more, then we use an aspiration catheter and then we follow it up with the balloon. In some circumstances, the wire itself opens it up and thereby we can put a stent or a wire mesh or a scaffolding directly on top of the blockage. Now you might want to know why a stent is used. A stent is used to hold the artery open. Its results are far better than what is done with just a balloon, because just a balloon, the risk of reblockages is high. A stent is nothing but a corrugated metal tubing which reinforces the strength of the artery and enables the artery to remain open. We use traditionally international quality stents with high quality data behind them, and the risk of stents blocking up is less than 1%. Now you can see in the picture, I have passed a balloon through, we have opened the artery up, and exactly where the blockage is, we have re-established flow. Now we put a little wire mesh, as you can see in the following pictures, which enables the artery to remain open. This entire procedure usually takes about 15 to 20 minutes to complete. Once the angioplasty is done, once the artery is open, the patient will notice a significant improvement in their symptoms, i.e. chest pain, difficulty in breathing or so. In some circumstances, when the narrowings are very critical, we might support the patient by other techniques like putting the patient on a ventilator, putting the patient on a device known as an intra-aortic balloon pump, putting patients on drugs called inotropes. All these are to augment the blood pressure, improve the blood flow through the artery, and thereby improve the chances of patient survival. This entire procedure, once it is done, your patient is usually awake unless they are on a ventilator. You are able to speak to the patient after the procedure is done, and the patient should be able to tell you how well or how unwell they are feeling. Following this procedure, we usually monitor the patient for about 24 hours in the intensive care unit or the cardiac care unit. If the patient is stable, we then shift the patient over for another 2 days to the ward. During this time, the patient is closely monitored in terms of heart rhythm abnormalities, in terms of development of heart failure. We improve the medications, we augment the medications, we look at the risk factors like diabetes, hypertension, smoking, diet. Our dietitian, we have a multifaceted team in looking after all these things. We have a dietitian, we have a physiotherapist, all these people are involved. Generally, by day 3, most patients who have had a successful angioplasty are in a position to walk back home. And this is the beauty of primary angioplasty. If it is done on time and if it is done by experienced people in a well-equipped place, this has got extremely good results and will make life-saving opportunities to increase for your patient or your family member. I hope this is quite clear for you. If there's any further questions, you could liaise with us either on email or through our hospital communication systems, and I would be more than happy to explain things further. Thank you.